Hello, Thrive Nation. We're going to be talking about stem cells today with one of the probably leading authorities on stem cell use, mesenchymal stem cell uses, based in Mexico. Brilliant stories, an author as well of the ultimate guide to stem cell therapy. Been in the game for a long time, from a pain to purpose backstory, which we'll get into. And it's a very warm welcome to bring Joshua Ketner onto the show.
Thanks so much. Glad to be here.
Brilliant. You've had a busy day at Dreambody Clinic, and it's incredible to see what's happening with stem cells. But let's start just defining what a stem cell is, what a mesenchymal stem cell is. I've been doing PRP for 15 years. A lot of my
Okay.
mentors in the US have been using bone marrow aspirate as well as lipo aspirate. And we've had incredible results, but obviously the technology has improved, and some countries don't allow the use of mesenchymal stem cells. So give us an overview, Josh, because I think it's important. People don't know much about it, or are confused about it, or have just read a headline about it, and we can get
Sure.
into the nitty-gritty details.
Yeah, and that's where we started the book too. It goes into all this because we wanted to simplify it. It's not a real technical thing. And the first is with stem cells. You hear the term stem cells and you just think these are magic cells. They're going to go in and fix whatever the problem is. They're going to turn into whatever kind of cell you need them to. Well, mesenchymal stem cells aren't like that. We worked with Dr. Arnold Kaplan in the past. He's the man that named them. Early 90s, he's playing in the lab at Case Western with these and start seeing that he can turn them into chondrocytes, to adipocytes. There's about 5 or 6 different types of cells he can turn them into, building blocks of cartilage, building blocks of fat, muscle. And he's like, all right, well, it's the mesenchyme system. There seem to be stem cells in the lab. Let's call them mesenchymal stem cells or mesenchymal stem cells. You can pronounce it either way. And the name stuck. But then as they started researching more, started putting these into animals and then humans, they found when they're in the body, they don't actually differentiate, meaning they're not going to turn into a different cell type. So they're not that magical stem cell we were hoping they would be. They're still magical. They do some incredible stuff, but they actually work via what's called the paracrine effect. It's the signals they send out, these extracellular vesicles. They're now being called exosomes. There's over 1,000 different types of these signals they can send out. And these are like messengers that send out a single cytokine or a single growth factor, these messages to other cells to tell them what to do. So they're really more like the manager on the construction site. Dr. Kaplan did a study, tried to rename them medicinal signaling cells, but nobody used that name. So the MSC moniker stuck, stem cell stuck, and almost every type of stem cell therapy you hear about that's working is this kind of stem cell. So that's what we use, extremely safe, extremely effective, and that's what we're doing.
Brilliant. Now, I do want to talk about mental performance, mental health, cognitive decline. Been in practice 26 years, never seen so many issues just with brain fog, people battling with
Yeah.
anxiety, battling with depression. Obviously, the COVID time caused significant issues, and people didn't have reserve. And wow, did it show with my patients and clients locally and worldwide, because we got clients all over the world, as well as in the US and across the globe. So tell us exactly, how would a stem cell approach someone who's got anxiety, someone who's got PTSD? What would you be your approach on someone saying, listen, I've been struggling, I've tried antidepressants, tried anti-anxieties, it hasn't worked for me, or the side effects are just too severe to cope with?
Well, I guess on the side effects we could help, but to just fix anxiety, to fix depression, that's really not something our treatments will do. We can get them to the brain. The treatment we do for that is we go into the lower back, we go intrathecally. So we're going into the thecal sac, the sac around the spinal cord. We're going to take out 2 milliliters of spinal cord fluid, and we're going to put in 2 milliliters of sodium lactate, which is our suspension for the mesenchymal stem cells, with 50 million stem cells. Now we can do this because we're using a pure product. Our big advantage in Mexico is that we can isolate the stem cells, so there's no other cells in there. So in the culturing process, the stem cells adhere to the plastic of the flask, because when you're taking the cells from the tissue, you're not ending up with pure mesenchymal stem cells. It's like you mentioned the bone marrow aspirate earlier, these different things. We have to flush those other cells out with an enzyme flush during the culturing process. they eat through that. So we're able to get a pure mesenchymal stem cell. We can put that in, not risk infection, no meningitis, any issues there. It's a weird place to get injected. I've done it twice personally, and it gets up through the spinal cord, up to the cerebral spinal fluid where it can get to the brain. Now, you've got this big electrical system in the brain. So if you've got anything blocking any of those electrical systems, you have a very specialized immune system in the brain. It's mostly macrophages, these specialized glial cells that help remove waste. Well, the stem cells, they have a profound effect on the immune system. They'll help influence it to do its job better, or like it did when you were a little kid. And so it starts clearing out that waste. We are seeing that it's helping with neurogenesis. We've had a lot of MS patients where we have before and after MRIs where we've seen the brain lesions actually fully heal. So we know it's getting there. It's helping with the neurogenesis. It's helping with neovascularization, which is new blood vessel formation. You've got more blood flow. You can get more help to the area, more oxygen, better things. So if it's an injury type issue, like we get a lot of like ex-soldiers that have traumatic brain injuries and a lot of football players and MMA guys, if that, and there's a huge connection between those kind of traumatic brain injuries and depression and other mental health issues. So we're doing really good work at helping those. A lot of stroke recovery patients, but for anxiety is a bit tougher because you'd really want to get more to the vagus nerve. And we've played around with these injections, but you have to go in here through like the clavicle, and it's tough. You got to guide it with ultrasound. There's a lot of arteries you could hit. And even then, we didn't see like a huge change in the nervous system response. So I think there's better options. Like I'm a big fan of like progesterone cream, can really help minimize adrenal response and stuff. So I wouldn't do what we do necessarily for like anxiety. I think there's other ways to hit that. But if anxiety, depression, these things are caused from like stroke or traumatic brain injury, MS, then we're the right fit. So you kind of have to do an assessment first and find out what it'll
Sure.
help.
Sure. And if we just put anxiety out of it, looking at someone who's got brain fog, not getting this
Mm.
lymphatic system at night because sleep, the lack of quality sleep and quantity sleep is causing a lot of issues, especially because people aren't looking after their sleep. Does that
Big
help
time.
if you're looking at this type of treatment? You've seen people get rid of, these proteins that have built up, and you've noticed the change with any neurodegenerative conditions, things like Alzheimer's and dementia?
Yeah, those are tougher. You have to catch them really early to really see a big difference there. People with more progressed Alzheimer's, dementia, you won't see as much. But if like you get early onset dementia or you catch it right at the early stages, like in my background, I worked a lot in memory care before I was doing what I'm doing here up in Seattle, and worked with a lot of Alzheimer's patients. And when you first start seeing those first signs and symptoms, like they're losing context in the middle of conversation, these sort of things, we've seen really good success there. But if it does progress too far,
Mm.
it gets tough. For me, like I was kind of dumb when I was young, probably drank too much, lots of dumb things. Sure, I caused some brain damage back then. And I did the intrathecal, and the first thing I noticed was almost immediately I started remembering dreams again. So I know it affected my memory because everybody dreams. I just never remembered them. And since treatment, I still almost daily remember dreams. I find just more clear, more focus throughout the day. We're getting a lot of people with different effects from COVID with brain fog. And that's really been the go-to has been the intrathecal treatment, kind of clear that up, get them focused and back on path.
Now, you're not using the patient's uh, fat, you're not using their bone marrow, you're using mesenchymal from where?
So we take it from live healthy births, so the baby's born, and the umbilical cord and placenta would normally be thrown away. So we take that tissue, but we're really strict with this. First, we only need one of these every couple months, so we're not going through a lot. We work with a specialized team of gynecologists that they only work with first-time mothers. So they have to be first-time mothers. They have to be between the ages of 18 and 25. They have to be healthy. We do all kinds of blood work, scans. Look, a mesenchymal stem cell can't carry a virus, so you don't have to worry there. But if the donor had a retrovirus, there's a less than 5% chance of carryover. So most of those are sexually transmitted. So that's why we ask how many sexual partners. They answer more than one, disqualified. I mean, we can't verify that, but the blood work will check all this. So we check the patient, then the tissue, then the isolated cells, then the cultured cells. And we do it with a third party lab and we do our own internal testing. And we give our patients that analysis from a third party lab. Because the cool part is you want to take it from the youngest source possible. This 9-month-old tissue is the youngest, healthiest. It hasn't had the stem cells in it haven't had a long exposure to an immune system. So they haven't built up any sort of like bad habits. You're not going to transfer over some like autoimmune disease. In fact, we treat tons of autoimmune diseases because these young, healthy cells are the best. Like if you're a type 2 diabetic, you don't want your own stem cells. They're already compromised. You want them from someone younger, and you could take them from any person younger because mesenchymal stem cells don't exhibit what's called HLA, human leukocyte antigen. So that's the marker that would tell you it's from your body or not. And since they're immune privileged in this regard, your immune system won't attack them. It just thinks you have more mesenchymal stem cells, which you did when you were younger. So now your body starts healing like you did when you were younger. And that's the big benefit here.
Okay, so you do your due diligence, make sure they're clean, very, very healthy from the umbilical cord all the way from the placenta. And then for someone with any neurodegenerative or any brain fog, you do intrathecal. What about using
Yeah.
IV stem cells? Would you use that with someone who's really struggling with mental performance? We're seeing early onset cognitive decline. We're seeing people just inability to use the two hemispheres in a way that helps them focused, stay focused, sustainably focused. So when would you use the IV and is it applicable to cognitive decline?
Yeah, I think it is. I'm sure, as you know, there's a huge connection between gut health and brain health. The IV does wonders for gut health. We have fixed more stomach issues that they couldn't even diagnose than I can count. We have ulcerative colitis patients in remission. I just posted a video with one of the top neurologists from New Jersey. We just treated him again for his ulcerative colitis. It works incredibly well for stomach, and there's that connection. Now, the reason it's not my go-to for brain excuse me, is that when you do an IV, it first goes to your heart, which is great if you got heart issues. We're fixing tons of congestive heart failure and issues like that. And everybody's got some damage, so we get that. Then they go to the lungs, but the lungs act like a filter. About 70% of the MSCs in an IV are going to get stuck there for 2 to 3 hours. And a lot of them will pass through and go systemic, but the brain's the last part that they go to. And it has to cross the blood-brain barrier, which we're pretty sure it does based on quite a few before and after MRIs that we have of MS patients with lesions and such. But it's tough because technically they're too large to fit through. It seems like they're almost like a mouse slipping under a door, kind of, they can kind of change shape, or they might be sending their exosomes through. I mean, we're not totally sure on that, but either way, they are affecting, but it's the least effective way to get to the brain, where when we go intrathecal, there's no blood-brain barrier pass. We're getting right to it, the full stem cells in there doing its job. And we've seen just night and day differences since it was probably like 5 or 6 years ago. We switched to that and just saw huge improvement with neurotype issues. So the IV is great. There's a ton of other benefits. We're getting DNA methylation test results back from patients showing it's reversing biological age. And all those things will contribute to better brain health, but it's not the go-to. I'd say intrathecal number one. And yeah, if you want to stack IV on top of it, tons of benefit, it's worth doing. But if it becomes a cost issue for people, the intratechal's the for sure.
Mm. And not much risk with the intrathecal, because I know a lot of patients are going to ask me about risk of IV and
Oh yeah.
intrathecal.
So with the intrathecal, I mean, look, you always have a risk of infection, and that's the last place in the world you want to get an infection. So we have a specialized sterile room that we use for that, that's cleaned after every patient, sterilized, a whole protocol. In Mexico, only neurosurgeons or anesthesiologists are even allowed to perform that treatment because it's so delicate and complicated. They're trained on it. And anesthesiologists do it the most. They're doing this to patients all throughout the day. We probably treat like 5 to 10 patients per week with intrathecal, so quite a few. And never had any issues. We sterilize the whole area. I mean, you feel like you're in an operating room. They use all the same materials. Everything's lined with the same materials. So It's very safe. You know, the big fear is, even for me, look, I've done it twice and it wasn't any easier to do the second time than the first time because mentally you're like, this needle is going to go into my spinal cord area. I mean, that's scary, but it's a 25 gauge needle. It's barely bigger than an insulin needle. It's kind of long because it has to go in a ways and you barely feel a poke and it gets in there. And we know we're in the space because we're able to draw out spinal cord fluid. So it's not like you're going to miss, you have to worry about that. And it's such a tiny needle that you're not going to create any like lasting damage. It just seals right back up. And you can get a bit of a headache from it just because you're changing the cerebral spinal cord pressure. So the migraine with it isn't always fun. It doesn't always happen, but that's the worst case is you get a bit of a headache. We've never had an infection or any issue there. For the IV, look, it's going to flare up your immune system because you're getting a lot of something new into your body. So sometimes you'll get a fever. I've gotten a fever maybe 2 times in the past 8 years and I do a lot of IVs. And it happens maybe 1 in every 50 patients or so. And it's because the immune system reacts. It's all this new stuff, but then it realizes no HLA, it's fine. It backs back down. You take a Tylenol, it's gone. It never lasts. So it's extremely safe. That's the great part.
Brilliant. And you're saying it affects the immune system. So, autoimmune conditions have exponentially increased in my practice and clients. With these type of autoimmunes, rheumatoid arthritis, ulcerative colitis, things like Sjogren's syndrome, multiple sclerosis, Hashimoto's thyroiditis. Just tell us about your success and your process that you use with regards to autoimmune.
Yeah, so for autoimmune, the go-to is the IV. And we've found that doing about 1.4 million per pound of body weight, which is 3 million per kilo, is sort of, think of it like a parabolic curve that starts to flatten out at the top. You hit this point of diminishing returns, right? So for someone like me, I weigh about 240. So realistically, I would probably do like a 400 million IV for my body weight. But let's do easy math. Someone 150 pounds, that's 200 million IV. Them doing a 400 million IV isn't going to give double the results because you hit this point of like peak effectiveness. So you can increase the dose even higher, but you're not going to get double the results. So with autoimmune disease, we found that's kind of the perfect range. And they go in systemically and they interact with the immune system. They're mainly sending out these specialized cytokines that influence the immune system. It's sort of like hitting the factory reset button. Your immune system, whether you've got rheumatoid arthritis, ulcerative colitis, MS, Sjogren's, it's attacking the body when it should be protecting it. So this hits it back to factory reset. It stops attacking, starts protecting. And the cool part is it seems to last. It's pretty rare that it wears off. We've been doing this for 8 years. I have patients from 8 years ago with some of these conditions that are still in remission. That doesn't mean it might not flare up in the future. Something might not happen, but the results seem to really last a long time and sticks with it. Now, for certain issues like, say, Hashimoto's, because it affects the thyroid, we also do an injection to the thyroid just to help with inflammation there and to hit it more direct. And that's actually increased our success rate there, it getting all the TSH and T3, T4 all back in order. Where with MS, we add the intrathecal because even though we fix the immune response, we want to fix those lesions in the spinal cord of the brain. So we go intrathecal to help speed up that process. So most of them are just an IV, but for certain ones like rheumatoid arthritis, we might have to go to the joints if the cartilage is too worn out because cartilage gets very little blood flow. So an IV is not going to fix your arthritic knee. You need to go direct. So, yeah.
Brilliant. And what is your success rate with autoimmune conditions? Because I mean, this has become a significant problem. Are you getting a very high
Definitely.
success rate? And how many sessions do
Yeah,
they need? I know it's patient specific, but these are the questions I get. Say, you know what, I've had
totally.
ulcerative colitis for 10 years, and how many sessions is it going to take?
So it's everybody's different, right? We always hope it's one and done. That's our goal. That's why we use so many cells. Most patients are doing, 2 or 300 million for one of these issues. But there are some cases where, like that neurologist who was just here from New Jersey. I mean, yeah, we did an interview. He said he's like 80, 90% better, still a few little gut health type issues. So he came back again this year. I mean, it was tolerable. He would have been fine, but he wants to be perfect. So in a case like that, we get someone 80, 90% done. They might be fine with that. Other people want to come back and do it again to knock it out and be done
One
with it.
session, one IV. And
Yeah, one
and how
IV.
long did he have ulcerative colitis for? And he's a doctor, neurosurgeon.
Yeah, and he's tried everything. I mean, if anybody's going to try anything, it's a neurosurgeon, right? So he's done it all, and this is the first thing that's really helped him. And it was one session. That was a year ago. And yeah, I just posted that video a few weeks ago, so you can take a look. But we have a lot of people like that, that one session's typically enough. Sometimes it takes more than one, but I'd say about 80% of the people, it's one and done. They get the results they want. There's about 15% of people that maybe need a second session, especially someone like him that's had this for like 20 plus years. It seems like the longer you've had that autoimmune condition, the higher the likelihood you're going to have to do like a second round. That's what we found. Um, and yeah, 15% of people have to do it again, and 5% of people are just non-responders. That's what we've seen in our clinic. And if you read through the literature, that's what most of the studies actually work out to too. And we don't know why. Some people just don't really respond to it. And diet has a big effect on autoimmune too. I think there's a big connection with what they're spraying on all the foods and GMOs and all that. I mean, who knows? I can't prove it, but I wouldn't doubt it. So you really want to help people with their diet to make sure that they don't bring it back from eating the same things that caused it in the first place.
Yeah. And do you combine it with any therapies like hyperbaric oxygen therapy, laser therapies, infrared? Do you do any sort of combination therapies that make a bigger difference, or is it just straight the stem cells?
I think those are all great therapies and I recommend them to patients, but those aren't quick fixes. So like hyperbaric, right? You'll see some of these other clinics that do what we do and they do the big show of putting them in and it looks cool. But one session of hyperbaric is not going to really make a difference. You need to, I think one of the best studies was done up in Canada with an Israeli group where I think they hit like 40 sessions before they really hit those therapeutic,
Mm.
started seeing a change in like DNA methylation tests for results. So I tell people when you go home, if you can find a clinic that does hyperbaric, man, I can't suggest it enough. I'm a huge fan of it, but it's a continual kind of thing. So that you would want to add yourself, red light therapy. I mean, there's so many benefits to that, but that's something you're going to do continually when you get home. Doing it here at our clinic when you're only here for a few days isn't
Okay.
going to make a difference.
So you don't have an example of a group that did do hyperbaric after their stem cells, because obviously the hyperbaric, putting pressurized oxygen or even something like EbO2, you haven't
Mhm.
seen the difference with someone who does stem cells and the therapies to someone who just does the stem cells.
No, I mean, I've had patients do those things, but not a lot. And we're still seeing the success without it. I mean, again, I think it's great to do those things. I think it's a great combination thing to add in, especially with like stroke patients for the brain or traumatic brain injury. I always tell them they should, but usually they already came here and did this and they're pretty content with what they got from that.
Brilliant. And stroke patients having damage to the brain, or have you found stem cells work?
Yeah, it's incredible. There's a really great study on intrathecal application of stem cells for stroke where I think they had like a 90% success rate if the patient got the therapy within a year of having the stroke. So with the stroke, the time that you get it done does make a big difference. I mean, we've had success 3, 4, 5 years post-stroke, but if you want to, the highest chance of having no lasting effects from the stroke is if you get it within 1 year of having that stroke. And I mean, we've seen like, the Bell's palsy, we've seen partial paralysis clear up from the intrathecal, speech come back. It's pretty incredible.
Oh, sounds amazing. Tell us about your joints. I've done prolotherapy now for what's it, 15 years, over 32,000 sessions. Knees, we get a 95% success rate. Obviously, using PRP, it's 5% of people we don't get a result. The rest of the body, we're seeing at 80%. Osteoarthritis, degeneration in the spine. Tell us about your stem cell sort of success rate and where you do the injections.
For joints?
Yeah.
Oh yeah, no, we do a lot of joints. So yeah, it's about the same right there in that like 80% is one and done. It really depends on the issue. If you're like third or fourth degree arthritis, I can tell you right away it's going to take more than one session. I've
Yeah.
seen a few patients go from third degree to like fully recover the cartilage, but typically third or fourth degree going to take more than one. First and second degree, usually one and done. Meniscus, ligaments, tendons, labrums, these things heal really fast usually. Typically takes about 3 to 6 months to see peak results. But yeah, the cells get in there, start clearing out all the scar tissue, and then start regenerating that tissue underneath and clears it up. For certain joints, we'll add PRP. If we're doing like a shoulder or a back, we'll add that because we're just getting a lot more growth factors in there. It always helps. But for like a knee or a wrist, there's not enough room. We found that putting too much fluid actually ends up causing inflammation and problems. So that was one of the first things we learned 8 years ago. No PRP in certain areas. So
Yeah.
it's been really good. I'd say knees are the most common thing we do. Lower backs are probably number two. And we treat a lot of different joints.
And how many mils do you inject in the knee, in the back, and the neck?
So most joints are 50 million. That's what we've kind of found to be the sweet spot for like effective price and effectiveness to kind of hit it as, well as possible. For the back, we do more. Like I had a herniated disc at L4, L5 4 years ago, really bad sciatic nerve pain. And we did treatment. We do 4 shots at 25 million around the most affected disc. We don't go into the disc. We tried that in the past and actually didn't see better results. And it added a lot of cost and risk with all the anesthesia and stuff. So we found that just going around the disc, because the disc rehydrate at night, you decompress the back when you're sleeping. So when you have those in there to guide that rehydration process, we've been able to regenerate the disc back to normal size and shape. And we also do an IV of 100 million because there's so many muscles that support the back that we found patients that in the past that we used to give the option to do the IV with it or not. We had quite a few patients that just, younger guys, bros, wanted to go to the gym and lift heavy and started lifting heavy too soon because nerve pain tends to heal really fast from stem cells. So like my sciatica was gone within 10 days of treatment. The disc wasn't fixed at that point. The stem cells send out neurotrophic factors that guide the nerves to regenerate with the neurons and kind of reroute it around that impingement. So you can fix nerves really fast with stem cells, but that gives some of these guys a false sense of security and they go start lifting too heavy too soon and end up hurting themselves. We found guys that did the IV with it weren't hurting themselves. So we just made that like the standard protocol to do both.
Hmm. What about eye conditions, things like glaucoma or damage to the retina through type 2 diabetes? Because I mean, once you lose your eyes, it's a big issue. Have you found stem cells work really well there?
No, we don't do any eye treatments. And the reason why is that most of them, your best results would be if you inject it into the eyeball, which there are some doctors that do that and it does work really well. But the problem is the fluid inside the eyeball has never been exposed outside of there. It's highly susceptible to any sort of infection. And there was a couple of really famous cases in Florida. So in the US, they can't isolate the cells and replicate them and administer. So they'll do like a liposuction, right? Take some fat, spin it up in collagenase and administer it. But what they won't tell you is it's not really a stem cell therapy. I've seen Dr. Kaplan yell at people for that. It's a cell therapy because there are stem cells in it, but maybe a few 100,000. It's mostly other types of cells. And there was this doctor in Florida, and she was injecting into eyeballs and having success, but she ended up blinding a few people because if this eye gets infected after injection, well, the other eye is going to go blind too, even if it's perfectly healthy because of the optic nerve. So it's not worth it for us. We looked at adding a treatment. We worked with Dr. Yuri Arenikov out of Beverly Hills. He's a Russian guy. He's one of the top eye surgeons out there, and he's also got a PhD in what is it, like molecular biology or something. Really smart guy, and he taught us how to inject in the lower eyelid under the eyeball to get to the optic nerve. But we don't have an ophthalmologist on site, so we decided not to keep adding that. We might add one in the future if we can find someone that wants to help, but that would be more for like your macular degeneration, for your for more the nerve related. For the retina, I don't have anything. I've seen people's vision improve from IVs, but not consistent enough to ever listed as a treatment.
Okay, and is he injecting this Beverly Hills doc? Is he injecting? Well, you obviously get some mesenchymal cells from fat and like bone marrow, but not to the same degree of concentration. Obviously, you got another. Is he injecting eyes and seeing changes?
Yeah, that's what he had told us. And he was doing like, you can use umbilical cord cells in the US. Like Utah Cord Labs is real famous for it. The problem is you can't isolate it. So you chop it up, you centrifuge it, and collagenase separate the cells from the tissue. And about 70% of it's MSCs, but you've got about 30% other types of cells. So it's not a pure product. Then they freeze it, which tends to kill a lot of the cells on the thigh. So you can still get a few million that way. And he does do some of those treatments where he goes under, but he came down to us because he just knew it would be more effective. And he's so busy, it's not like a main focus for him. So it's a cool idea and we might do it in the future, but as of now,
Okay.
it doesn't really make sense for us.
So what you're saying in the US and the rest of the world is you're still able to use the umbilical cord or the placental, but you can't harvest them or manipulate them or isolate them. How would you put
Yeah.
that into context?
Yeah. So in the United States, you can use umbilical cord. They'll take the whole thing right from the birthing room, and one patient's going to get that whole cord and placenta. And the process is, yeah, you go to the lab, you're dissecting it, you're thawing it, you're putting it into the centrifuge, centrifuging collagenase, separate the cells, and they then spin that down, concentrate it, but they have to cryogenically freeze it and then send it to doctors. And the problem is they don't train most of these doctors even how to handle it. You can totally use frozen cells. There's a big kind of, if you look online in YouTube videos, you're like, oh, never use frozen cells, they're horrible. And it's not true. It's just if you don't handle them properly or thaw them at the right temperature scale, like they have these, they look like little mini jacuzzis. It's filled with water. You put it in there and it slowly raises the temperature to thaw them properly. And you'll have very little die off. You'll still have die off from the thawing and freezing process, but much less. I mean, that's how every university, that's how they research and study. We prefer not to freeze them at all. We just take them straight from culture, administer, no worrying about that. But yeah, you can get them in the United States for mainly for joints. I don't think they can do IVs because it's not a pure product like that. It could be risky, but as far as joints go, there are doctors doing that. It's just the price gets really crazy and you're getting far fewer cells than if you came somewhere like to our clinic, then and it becomes a numbers game. The more you can get in there, the faster and better you're going to heal things.
Okay, so tell me about your process. You've got, because you said one placenta and one umbilical could last you, I mean, a lot of treatments. So
Mhm.
you've already prepared them, or on the day you've now got to culture them, or where's the umbilical cord and the placenta sitting?
Well, they're processed day one. You have about 6 hours from the birth to get it to the lab, start dissecting, start centrifuging. You're getting the cells into this liquid. And then with that liquid, once you've gone through the process, you've separated enough, you centrifuge that down to what we call a pellet. This little white pellet of cells that's at the bottom. You put that into your flask, you add collagenase, and you put them in your incubators. And in the incubators, you want to set the parameters to what they're going to expect in the human body. So you'll hear a lot of places talk about like hypoxic cells. Well, hypoxia just means less air. Any culture is a hypoxic situation. You want a perioxic situation, which means we're going to take that oxygen level down closer to like 10 or 11% to mimic the environment these cells are going to end up in when they get in the human body. So that does stress the cells because it's a much lower oxygen environment, but it's also preparing them so we take them from the lab. So you put them in these flasks, you put them in the incubator, and they start replicating. You've got the culturing medium in there, which is like their food, and they're going to eat through that. And after so many days, they eat through it. And now the stem cells have adhered to the plastic and there's still liquid in there. You're going to then do an enzyme flush to flush out the other cells. And then we add more culturing medium. So now we're on, they call it passage two. And it isn't till about passage three that you have a pure isolated product. That means you've gotten rid of all the other types of cells. And every time this whole time they're replicating, they're doubling, they're going there, you're getting more and more cells. And typically by like the fifth passage is about as far as we'll go. So what we do is we stagger these. We have different temperature settings on all our incubators. So every day we've got batches coming out and ready. So we kind of have to estimate how many patients and cells we're going to need for a day. But let's say I only estimated like 1 billion cells for patients today, and I really need 1.5 billion. It's fine. I just borrow some from tomorrow. And you can always do that because you're always adding more and it's a constant process. But because of that, we're able to extend that one umbilical cord to last a few months and help a lot more patients. So that does help keep the cost down. That's one of our big advantages. And we're getting younger cells because if we took them from myself, the big problem is a good thing is with these donor cells, they do lack HLA, but after 8 months to a year, they are going to differentiate. They'll turn into an osteocyte, a chondrocyte, an adipocyte, and now they're going to have the donor's HLA. So at that point, your immune system will recognize them, eliminate them, delete them, kill them, send them out of your system. You won't even know it's happening, but it's a good thing because you don't want someone else's cells in you first off, and it could cause problems down the road. So it's a natural mechanism. But if I took it from myself, the disadvantage is I'm 42 years old. If I take my own cells and replicate them, you're shortening the telomere length with every replication. And you have what's called the Hayflick limit. You get about 50 to 60 replications for a cell before it goes senescent. So if I start replicating these cells, I could be putting my own cells back into me that are like 50, 60, 70, 80 years old, telomere length wise, and they're going to go senescent sooner. So those are zombie cells. They're going to hurt other cells. I'm causing a problem for myself in the future sooner than I would have. So that's why I'm not a fan of using my own cells. You would think it's an advantage. You're like, it's mine. I want the same thing. But you actually want them from these donors so they can do their job and then your body gets them out.
Yeah. Amazing. And if someone's listening now, should they try and store their umbilical cord or their placenta at an organization, or is that sort of not applicable because the company might not know how to use them, how to manipulate them, how to get them into the right form to be used at a later stage?
I would say, look, I have my son's umbilical cord frozen in storage, but not for stem cells. I have it because if he ever gets any form of leukemia or bloodborne cancer, that'll save his life. So it's a great insurance policy. You want that, but as far as for stem cell treatments, I would never want to use his own cells because of that. They have to freeze the umbilical cord. That right there causes damage. You get less quality cells. And second, you replicate them and you're going to put cells back into him that are older. It's just not worth it. You really don't want your own cells when it comes to this type of stem cell. But there are other things you might want that for in the future. So I think it's worth doing, just not for this.
Okay. So what do you say, leukemia or cancer? How's it going to work there?
Well, like I call him Uncle Mike. He's my mom's cousin's husband, right? He got leukemia later in life, and they ended up doing a bone marrow aspirate, ended up being the right fit for him because there you want hematopoietic stem cells. Those create your red and white blood cells. Those are found in the bone marrow. The problem with getting a donor, and so technically they've been doing stem cell treatment since the 60s because they've been doing bone marrow transfers since at least then. And those type of stem cells, the problem is, and this is really fascinating for people that like those like true crime stories, but Uncle Mike, if he went and committed a crime today and they took a DNA scan, they would arrest his sister because it changes your DNA into yours from the donors, actually. It's really crazy. I mean, what it does there. So hematopoietic stem cells are awesome for red and white blood cells, which is how you want to fix that. And that's what you would use those frozen cells for, because there will be hematopoietic stem cells in there that now, yeah, you want your own that were younger and fresher and working right, because now yours aren't working right.
Got you. Now, this is such a, like it's been brilliant and great results, been going on for a long time. I spent some time also just reading Dr. Rawdon uh,
Yeah.
and just his view and when he started as well in his clinic, I think it's in Panama, or is if it's
Hmm.
like incredibly effective and changing so many people's lives, even this New Jersey neuroscientist, why hasn't it been taken up by, the Americas of the world, the UK, Australia?
Sure. So I'll give you a good example. I have a patient that his job, he's retired now, that his job was Merck, AstraZeneca, Pfizer. He worked for all those companies. His job was to inspect labs. So he'd go around the world, check out different pharmaceutical companies on behalf of these big pharma companies, and decide if they were up to par and worth buying. So he knows everything about labs. And he has a friend in Idaho that had a lab doing what Utah Cord Labs does. Now, the rules are really vague in the US. It's two main rules. You can use these cells for homologous use, which is means like for like. So it's really, I mean, we have a good video with what a doctor from Scottsdale, Arizona, that was doing these treatments and came to us because that rule means he would do nerve stuff, and there is a nerve that runs through the umbilical cord. So he goes, well, that's technically a nerve, is treating a nerve. So that would be his excuse, and minimal manipulation. So just like PRP, right? PRP you can do because it's considered minimal manipulation. You're just, spinning up blood and re-administering it. Well, same thing with these umbilical cord cells. You can do that. So this lab in Idaho wants to do that. They hire this guy who's their friend to get them because he knows all about labs. They get GMP, ISO, all the qualifications that FDA is going to look for. But when the FDA comes in, they go, oh, well, that's a new medicine. You have to file a new medicine application. And he's like, what? All these other labs do this, but they've been kind of cracking down on it. They don't want new places doing this. They're actually trying to shut it down. And they said, well, new medicine application is $2.5 million. Well, they're done at that point because they can deny that request for like a comma being wrong on your application. It's totally up to their discretion, right? But he says, look, let's pretend I applied it. So I get approved. All that approval does is allow me to start the 4-phase FDA trial process. That's usually a 10-year process and will cost you hundreds of millions up to $1 billion to do. And here's where it gets crazier. You can't, like, if you look at my website, we treat like, there's probably 70 different treatments listed there. You only get to pick one thing. So let's do the most common thing, cartilage for knees, arthritis, right? So that's all he would be able to do this test for, and he'd spend all that money and time. And even if he made it through all 4-phase trials and it got approved, the problem is mesenchymal stem cells are natural. You can't patent them. So all he would do is open up the market to his competition, which would then undercut him on price because they didn't spend $1 billion on this. They'll just go build a lab for a couple million and put him out of business by undercutting him. So the whole system
Sure.
is set up to protect these big companies. And I know it sounds crazy, but it's a really broken system because of that, where there needs to be a different process because it's working. There's over 100,000 studies on Google Scholar. I mean, it's proven to work at this point. They're just holding it back. In fact, in Canada, they used to do it, and 7 years ago, they shut it down because the orthopedic surgeons threw a fit and petitioned the government to shut it down because it was taking too much business from them. So it's
Wow. Is that
it's
a true
horrible.
story? I mean, it's so effective that these guys had the power to shut it down and then to validate the fact that it takes so long for a big pharmaceutical company to register medicine, so costly. And that's why they've got to ensure that they spend a lot of money making profit once they've done the registration process.
Yeah, they have to. I mean, it's going to cost them hundreds of millions just to bring something new to market. And a lot of things don't make it through the trials. I mean, they need the trials, they need that regulation. I mean, I really agree with all that. They just need a different way to fast track things that work. And I don't know. I don't know how to fix that. So I work here in Mexico.
And now, what does the Mexican board say, or what other countries where are you allowed to manipulate and take out and
Yeah.
produce a product?
So Mexico's got we have socialized healthcare here, but we also have private care, and both are good. It's just that it's kept the cost down of private care. Doctors don't make much money in Mexico because most people will just go to the socialized care. So they have it ends up good for, I guess, the patient, but kind of tough for the docs and to push the medical system. Well, here, Mexico has gotten so fat from people eating junk food that I think we're one of the top diabetic countries in the world now. And the socialized healthcare service almost went bankrupt. They had to stop giving metformin for free to people because it was bankrupting the system. And that's one of the cheapest medications in the world. So the guy that I initially met, he did his PhD 18 years ago and here in Mexico in cellular biology, and really smart guy. He was working with some of the senators and he got them to push it through that they found this works for type 2 diabetes. So they kind of fast tracked it. And they have basically the FDA same process here. It's just much cheaper and much faster to do. So they passed some laws to allow it because they saw that it worked. So that was our big advantage here. There's only a few countries that do that, like Panama, where Riordan's at here, I think the Cayman Islands. So there's not a lot.
Wow. All right. Now, I mean, I worked in Mexico when I did all my pro bono work when I was registering as a regenerative medicine doc through the American Association of Orthopedic Medicine. So I know the situation there.
Yeah.
Not healthy people at all. We are just sure. And poverty stricken, eating all the wrong things, refined carbohydrates like you can't believe. So are you saying to me any other Western countries this is a problem just from the due diligence point of view, or are you talking about a socialist country like Austria or Switzerland that's going to be able to push it through for the benefit, or where do you see stem cells going then?
And that's the problem. Like Switzerland, I mean, there's Swiss Medica out there, and they've had to open up their clinic like mine in Serbia because the EU has the same rules as the US and the UK and Australia and Canada. They're all holding it back basically, mainly because it's just this big loop of the healthcare system and the pharmaceuticals all kind of work together. So the only developed countries that are really doing real research and pushing it, I mean, everyone's doing research, but it might bring some stuff to market is Japan and South Korea. They've created some really good structural framework to push stem cell therapies, to have real regulation and like, itemized treatments. There's one treatment in the US, I think it's called the MACE procedure, where they take the stem cells from the patient, they differentiate them into osteocytes, which are the building blocks of cartilage, and then they put them into the knee in this gel to kind of, it's a sort of cellular matrix to hold it there. And that actually got FDA approved, but it costs like $50,000 or $60,000 and insurance won't cover it. So nobody's opting for it because you're going to get the same results coming to a place like mine for a tenth of the cost or less. So it becomes cost effective too, even if they did approve stem cells in America, I'm really not worried. I think all it would do is bring more attention to it, and I would still have the cost advantage because it's just, it would be something new and the cost would be higher. It's just the way it goes.
Let's talk about cost. Like, what is a stem cells for knee or lower back, or an IV stem cell, even an intrathecal stem cell treatment?
Sure. So I hate it when you can't find prices. So my whole website has all the prices. Everything's listed, protocols. We don't differentiate from protocols, so it's there. But like a knee, a shoulder, an ankle, an elbow, it's all kind of the same cells, 50 million. We do an MRI, we do blood work, cover it all, and it's $3,300. Intrathecals, 3,300. Back treatment is more because it's 100 million in the back, 100 million IV. That's 8,250. Probably the more expensive treatments would be like a 300 million IV. If like we're talking for autoimmune diseases, that's $10,890. But we have lower dose IVs too, like 100 millions, 3,850. So we try to keep the price as affordable as possible to help as many people as possible. And that's why we have it all listed so everybody knows, hey, I'm getting the same price. I'm not having to call in, and it's not, some of these places, it's like used car style there.
Yeah.
You have to, it's crazy to me.
No, that's honest. That's honest, Josh. I mean, that's incredible. The Dreambody Clinic. Just give a message of hope with regards to stem cells. I mean, I think it's an area that can help so many people. It's just not widely used. Obviously, you're going to give us, your location in Mexico. I've been there. Incredible place, incredible people, but not healthy people. But give us sort of, an overall message of hope with regards to people that are struggling with these chronic conditions.
Well, yeah, I think the overall message is that there's options. You can do some research. You can see, like every week, I'm trying to post new testimonial videos. We get a lot of repeat patients. usually for new things. We're hoping we're not having to do the same. But yeah, we try to post those videos so you can see real people. I'm not focused on the celebrities and all that stuff. We get some of those people, but I don't care. Like, I want you to see real people. I want you to see that, like, we're helping these people and they're getting results. So that's what we're trying to do is just keep helping. We treat 100, 150 people a month, depending on the month. And that's perfect for us. We're not trying to get bigger than that. We're not trying to be the biggest clinic in the world. Like you mentioned, Dr. Riordan, his clinic's huge. They do tons of people, and it's a lot more expensive. He did his PhD under Dr. Kaplan, but they do the exact same thing as us. And but his book is great. Like, we just put out our book. His is a bit more technical. Both are really good ways to learn about this and see if it's something right. And we get a lot of people from all over the world. UK, we had 2 patients from Australia yesterday. We get, yeah, from all over the place.
Mm. And if someone's considering it, 48% of our listeners are in the US. If they're considering it, do they do an online consult first? How do they engage in the process?
Yeah, so they go to our website, the www.dreambody.clinic. You can scroll down on the homepage. All the treatments are there. You just click info, studies, testimonials, prices there. And then we've got the phone numbers, and you can call in, and you're usually going to talk to me. Like, I've had sales guys in the past. I got rid of them all because you need people that care. This is your health. We want to make sure that, again, we're not trying to scale this. I'm not trying to be that. There's lots of stem cell clinics out there. More keep opening. I think that's a good thing. More people need this. They need the help. If you want to come to us, we're just more concierge. You'll probably talk to me. You'll talk to the team. We've got, excuse me, we've got 3 full-time doctors on staff that do most of the treatments. I've got 2 anesthesiologists. I got 2 cardiologists, an internist. We'll get you the answer. We're not a diagnostic center, but if you've got MRIs or scans, we'll review them for free, and we'll be honest with you, because we don't want to treat you if we don't think it's a good fit. And that's because bad news travels much faster than good. If I treat someone I'm not going to help, that actually hurts me more and it hurts them. It's not worth it. If you've got a bunch of osteophytes on your knee, we're probably going to tell you it's not worth coming, because that's new bone growth. This won't get rid of it. So we're very honest with people of what we can and can't help. And if we can, then we try to make it nice. And we're in Puerto Vallarta, Mexico. It's tropical paradise on the beach. So it's a good little vacation. You're not at the clinic a lot. I was joking, it's the most anticlimactic thing you'll ever do. It's some quick injections for a quick IV, and it's not instant, but typically 3 to 6 months after, it's just boom, things stop hurting or you start feeling really good.
Brilliant. Well done to you. Just declare favor and blessing over you, Josh. You're obviously helping hundreds and hundreds of people, and that's what we need. These chronic conditions, very difficult to beat them. I mean, we're trying to prevent them. We talk about medicine 4.0, preventative, personal, proactive, and performance enhancing. But for those that have the conditions, having a treatment like this with such great results is something that we need, and like you said, it's not this temporary, okay, let's put you on medications for the rest of your life. This is a treatment that's causing a lot of healing and cure. Obviously, the people got to put the lifestyle in place afterwards, otherwise they're going to return with something else. You can't prevent damage, by doing a stem cell treatment, and 3 years later you're eating McDonald's every day. But yeah, let's end off saying the future of stem cells. Is it going to grow? Do you see this industry growing?
Yeah, it's already growing. I mean, when we started 8 years ago, it was pretty much us and Dr. Riordan. We're the only ones really, doing it the right way, and more keep popping up. And I think that's great. I think there's no way one clinic's going to be able to handle the kind of patient load if this really keeps going the way it's going. And I think it'll keep helping people, and hopefully more countries will open up to it. Again, like I said, I hope it gets accepted in the US and other major countries. Like, I think it'll just help the whole industry, and there's plenty of people that need this sort of help. So I'm all for it.
Well, great, Josh. Lovely speaking to you. Appreciate it.
No, thank you so much.